Hello guys, today we're going to talk about everything about nipples. What is normal, what is abnormal, what are the signs and symptoms you should look out for? So let's get started. Did you know that in the 16th century, doctors used to diagnose various women's conditions by examining their nipples? Thank God we don't have to do all of that right now. But anyway, there are 4 main types of nipples. The nipples can be protruding, they can be flat, they can be inverted or unclassified. But it is not necessary for any 2 nipples to be of the same type. Your 2 nipples can be of 2 different types, and that is why we get 8 different categories of nipples. The nipple is the part that is at the exact center point of your breast, and the part around that, which is generally a little darker in color, is known as the areola. Did you know that the nipple and areola can be of many different colors depending on your skin tone? The nipple can be light pink, or dark brown in color. Generally, Indian women have dark brown colored nipples. That is perfectly normal. Also, the size and the shape of the nipples, along with the color, can change due to many hormonal changes in the body. This happens when you first get your periods, or along with age, or even during pregnancy. Inverted nipples are completely normal. If your nipples are inverted, you don't need to worry about it. Generally, after pregnancy or delivery, during breastfeeding, they normalize on their own, and it does not interfere with your breastfeeding process. Very rarely, people can have multiple nipples on a single breast. If that happens, it is known as supernumerary nipples, and it can be removed with the help of cosmetic surgery. Nipple hair is completely normal. Just like the rest of your body, your breasts also have small hair follicles, which, depending on hormonal changes, can grow small or thick hair. You can deal with this by plucking or tweezing, but do not wax it or use any epilating thing on it because that area is very sensitive. A lot of females face a lot of nipple soreness and pain in the general nipple and breast area just before their menses. This is completely normal and it falls under the premenstrual syndrome category. If it is too unbearable, we doctors prescribe some painkillers or we can give some supplements to deal with it. Did you know nipples can also crack because of wearing tight workout clothes and having a very stressed exercise process? Or in breastfeeding mothers, there have been occurrences of cracked nipples. Generally, we prescribe some creams for this. The next thing is that women have a lot more nerve endings around their nipples than men. That is why women have a lot more sexual arousal when the nipples are stimulated. If you notice small bumps around the nipples, they are completely normal. They are known as Montgomery's tubercles, and a small amount of lubricating fluid comes out from there, which keeps your nipples moist and comfortable. Now let us discuss what is not normal. Any kind of bumps or lumps around your nipple or in your general breast tissue is not normal, and you should definitely go to the doctor to get it checked. The next thing that is not normal is if there is discharge or any secretion or blood coming out of your nipple. This is a very warning sign. It could mean you have a hormonal imbalance, or there is a cyst in the breast, or it could be a sign of a bigger issue. The last thing that you should watch out for is skin changes in your nipple. If you notice thickening of the skin, dimpling of the skin, meaning you see small holes around your nipple, or the nipple resembles an orange peel, these are warning signs that you should go and get checked for. Nipples of all shapes and sizes exist, and all of them are perfect and completely normal. But it is important that you keep doing regular self-breast examinations and also go for a yearly breast checkup with your doctor. If there is a family history of breast, stomach, uterine, or ovarian cancer, it is important for you to get a yearly mammogram done. That's it for today. Don't forget to subscribe to our channel so you don't miss any videos by us.